Okay, I want to welcome you all here today for our COVID-19 update with the Northeast Texas Public Health District. We have Mr. Hopkins with us, Russell Hopkins with us. He will be giving a presentation updating what we know today about the virus. On YouTube, welcome. I know we have many of you out there now viewing today's. If you got the email and have questions, please send those in to us as instructed on your email notification, and we will try to get those answered today. So that we don't have a lot of close proximity, we're going to try to keep this meeting somewhere around 45 minutes. But at this point in time, I'll turn the meeting over to Russell Hopkins.
Thank you, Judge. I'd like to start off and credit this presentation to my epidemiologist who put it together. It's been given by them several times. They are currently about to hear with stress and cases and trying to follow up with a totality of 7 counties. My service area in the whole service region of 35 counties has the majority of the population in those 7 counties. So we are seeing a lot of reports come in, a lot of requests for tests, and as you probably know by now, we do have some positives. So let's go back to the beginning and all the way back to Wuhan, China, the epicenter of the outbreak. And I will tell you kind of what's happening now. And you'll see it here in a minute in a dashboard presentation. You'll get a visual representation, but their increase has stopped. Their increases in positive cases has stopped and is only advancing in a trickle. When they ease some restriction, they see a couple of cases pop up, and they have a real aggressive contact tracing program. They go out and chase that down, and that area again is quarantined. And so they're trying to allow some civil return to civil life, but it's difficult at best over there still. And I bring that up as a projection of what is possible in the rest of the world as we get to the point that they currently are. So what is a coronavirus? This is a virus that is named for the way it looks. If you take it under a microscope, there is a corona around that like you would see in an eclipse of the sun. And that's why it's named coronavirus. This is a zoonotic disease. This comes from some animal that was being sold in a market in Wuhan, China. What are the symptoms? So early symptoms are fever and a non-productive cough. And that's a little bit different than the flu presentation, which usually starts with sore throat, sinuses, and body aches. So a little bit of difference in the case presentation. How contagious is it? Science is still trying to wrap their head around about how long does it actually exist on surfaces? How long does it hang in the air? It requires a bigger droplet because it needs a heavier viral load to spread than, say, measles or TB. So while it is not as contagious as measles, it's still more contagious than the flu. And we'll talk about an epidemiological concept here in a few minutes that might illustrate how that works for us. So a current outbreak status, Smith County has 5 cases. One of those was one of those cases was with direct contact with a known positive case, is how we are reporting that. How does this affect the United States? Current cases, we are over 6,000 at this point. Yesterday morning, we started off at 4,000. So we are seeing that exponential increase. It also tells me that it exists in the community a lot deeper than what we're able to test for, because testing is still a major impediment to the response. Persons under investigation, and what we've been telling folks is how the process works. It should work just like we do every day with all the other reportable diseases. That was changed when there weren't enough tests to confirm it, and a criteria was put in place, and initially we had to identify somebody to test, get permission from Department of State Health Services, and then have CDC issue a monitoring number for that person under investigation. That designation was given to them when there was a positive case. So if you are not positive yet, but your test is pending, we call you a PUM or PUM, patient under monitoring. So we would potentially have a test, your symptoms are minor, you're sent home to self-isolate, and your test may come back and you'll be notified of that and your status as a person under investigation. And so moving on to how do we protect ourselves? Well, there's many levels of that, and for you as an individual or a family, wash your hands. Wash your hands and wash your hands, and continue to wash your hands every day. When you don't have water and soap available, then switch to your 60% or better alcohol hand sanitizer. Practice social distancing. That distance is about 6 foot. This is a heavier airborne particle that carries the virus. So we believe that 6 foot is an adequate space for social distancing. That also means how to protect yourself in the context of social distancing. Don't congregate. Don't go to restaurants, bars, department stores, festivals, those kind of things. Even church is a terrible place to be right now. And I think a lot of folks are doing online services, and that may change the way church is done for the rest of our lives, because it's pretty nice. I talked a little bit about the PUM, PUI, and we'll give an opportunity to answer questions later. So our local health department EPI plan, if we have a person under investigation, is to notify our emergency management coordinators or health authority, the physician who would occupy that position, so that we can get that contact made, that we can run through that. The criteria that the state is enforcing at this point says that we have to make sure that there was international travel, they might have been on a cruise ship, there was known exposure, they're a healthcare worker, they're a first responder that came into contact, or you have the classic symptoms, and we've ruled out things like flu or strep. We may have either a CAT scan or an X-ray. Those are not definitive case definitions, but they've seen enough of those that if they see what they call ground glass on those X-rays, that is high suspicion, and those people would then fall into the testing criteria. So what's the novel coronavirus? Again, we've not seen this one before. It is in the SARS and MERS family, so the Middle East respiratory syndrome and sudden acute respiratory syndromes. The SARS was particularly tough in Asia, and even we've had some of the MERS cases in the United States who came back from Saudi Arabia. They are kind of hosted in a lot of different animals. There's some word that a pangolin, which is a scaly armadillo-looking weasel thing that lives in China. Cattle, camels, cats, bats, snakes, all can host coronavirus. When there is a medium or a vector to transport that to humans, it's got a new host that it finds out that, oh, my receptors fit into your receptors really, really nice, and I'm going to make you sick because I have fertile ground to replicate. And so people with immune systems are most susceptible to that. So when you are infected, you are potentially going to experience either the mild or severe form of the disease. Luckily, most people are mild to asymptomatic. It's nice that they're not suffering, but it's hard for the rest of the world to wrap their head around that me or you are sick and infectious, but we feel fine. We're asymptomatic. Now, the 20% that has the severe disease, a small portion of them will die. The current rate is 3.4%, and that is pretty much a standard even in countries that are not doing well, and I'll reference Italy and Iran. So how do we spread this? It's mostly person to person. I mentioned the 6 feet. If you cough, and these early signs are that non-productive cough, and it's one that you can't suppress. So that's a signal that it may be COVID and not the wonderful East Texas pollen at this time of year. Respiratory droplets, either in the air or on surfaces, get picked up. They get put in your eyes, your mouth, your nose. So that's why washing your hands, not touching your face is such a big deal. We are having some varying bits of scientific publications that show that this will die in a few hours on a surface. And then other surfaces I have seen as high as 15 days. But those are organic wood type surfaces that would harbor a virus easily. So how contagious is it? And here's the concept that I hope will make the light bulb moment for you. The R naught number is the epidemiological tool that they use to determine how much a virus will spread, or any type of illness. The R naught number for Ebola was 2. So if I presented and came down with Ebola, it is expected that I would infect 2 people. And if you look at Mr. Duncan's case in Dallas, he infected 2 nurses. And so Africa had told us that those are good statistics, and then they showed up in that one case, right on cue. So you can see how exponentially this goes and how it fits in with measles, Zika, HIV, or seasonal flu. Seasonal flu at 1.3 is very low. In order to stop the spread of disease, you have to have an R naught number less than 1, right? So the average is less than 1. It can be some, but it can never be above more than 1, or you risk the continued spread. Measles particularly is the thing that we always worry about because it affects kids, right, mostly. In this case, with 2 to 3.1 R naught number, you can see how quickly those can go off the chart. Again, mortality rate, 3.4%, and we believe that will be our experience too through this. So symptoms, fever, cough, short of breath, and we discussed the difference. We also have case presentations in the severe form where people need ventilator support. that's going to be an issue for the whole country. And we'll talk about some of the hospital concerns here in just a few seconds. Here's our dashboard. Today is 205,452 positive cases, 8,248 deaths, and total recovered is 82,091. Recovered cases at this time are now more than China has reported. So we should see that number tracking alongside the number of affected. Where that yellow line in the right-hand corner, those are countries other than China, and you can see the exponential growth. So what can we do to protect ourselves? Again, we got to avoid contact with people who are sick. We have to make it easy for people to stay at home, away from work, and away from others. They need to self-isolate within their homes, which means they need access to food and water and palliative care at home, but they really need limited interaction with the rest of the family. If the rest of the family is not practicing self-isolation, they will pick the virus up and take that with them to school or work or daycare, wherever they're going. Again, avoid touching your face with unwashed hands. Cover your cough and sneeze, and clean and disinfect touched surfaces regularly. And that's household recommendations. And also, when you go to restaurants, be aware that the drink dispenser that has a tab to open that has been touched repeatedly. And I saw today at lunch that they had completely removed that from the restaurant's normal area and was offering it where they would fill the cup for you. Follow the recommendations for face masks. That is for the general public, a face mask is not warranted. If you are ill and you report to your physician's office, ideally they would put a surgical mask or offer you a surgical mask to put on, but it is not necessary for healthy Americans to go out with a mask. And with the severe shortages for healthcare workers, we are really encouraging that those are essentially saved for that industry. Again, the hand washing information and hand sanitizer has to be 60% alcohol or above. So our initial EPI plan, if the local health department has a PUI for testing, we'll work with the healthcare facility. They'll call and say, I have a patient here who was in, for example, Summit County, Colorado, where they have an unknown spreader of coronavirus, and now we're back, and now we're symptomatic. We went through an airport. We have the fever, the dry cough, and the ground glass x-rays. We're going to test that person. And what the region does is confirm their status. They issue a PUI monitoring number. Communications to leadership, DSH Austin, and even CDC over in my area. We have a case that has international consequences for contact tracing, 3 continents of contact tracing. So pandemics really don't care about your borders or your oceans or barriers. It only replicates. So after that PUI monitoring number is issued, the healthcare facility will collect that sample from the patient and continue to treat and isolate as appropriate. We're not going to keep them in the hospital if they do not need hospitalization. There's just not going to be the room to do that. And then final determination will be made on that test sample and communicated. The EPIs will do the contact tracing, exposure follow-up history, and the local health department will coordinate between the facility and Flat Lab, which is the public health lab of East Texas. If you saw the governor's statement about having a testing center in Tyler, this is what it is. It's not a testing center. It's a laboratory that we send different kinds of samples as we do surveillance in our community. So we will be taking two kinds of specimens. Both of them are swabs. So if we get to the point where there are tests available and we do a community drive-up type testing center, we're going to get swabs. So we're going to swab the back of your nose and the back of your throat. If you're in the hospital and you're intubated, they may do the bronchial alveolar lavage, may do sputum, and may do the blood serum testing also. So another concept of public health response to this is, how do we mitigate the impact? If you look at this figure, that high peak is for the number of cases presenting to a hospital without any public health measures. And so we know we're kind of in a situation where one hand is tied behind our back. We have no vaccine, we have no pharmaceuticals to treat this. There's no cure for this. So put an imaginary line through about 1/3 of the way down from the top of that peak. You put an imaginary line through that. That's the number of hospital beds, right? It doesn't change. Whatever, and whether you're looking at Texas, America, or Athens, or Gun Barrel, those rooms aren't going to change. So how do we protect them? We make sure that purple area doesn't go above the line of rooms, right? So you have to suppress the virus and flatten the curve. And so if you have a nice long flat curve, we've extended the pain on the populace, but we didn't break our health and medical systems, and we end up saving more lives because they have access to ICU beds, ventilators. And so this is an important concept in why we're asking people to do the things that I see that a lot of people are doing. They're not going out, or if they are, they're very careful about not shaking hands or standing too close together or in a big group of people. And so we are getting a lot of good action taken by the public right now. And hopefully that will mean that we can stretch this out so that we never break the healthcare system. This is a link in this. It goes to a project that the Harvard Medical School put together. And I wanted to get out of the program and get over to that and show you what we're looking at with hospital usage. And in each row, you have a different scenario, right? So if 20%, if 40%, if 60%, and then look at what happens to hospitals. And if you look at 20%, one of the red areas is East Texas, because we have so little hospital capacity. We're nearly full all the time. We've had hospital closures for years now, so there just aren't enough beds. You can then look at what that would look like over 12 months. And so it's a little bit more painful, right? And then look what happens if you do absolutely nothing. 20% over 6 months, 40%, 60%. It's my opinion that if we experience 60% infection rate of this country over 6 months, the healthcare systems will be rubble. They will be destroyed. And I don't want to create any panic because they are working to mitigate that now. This is the same information in chart form. This also allows you to put in, you see up at the top, you could put in Athens, Texas, or you could put in Eustis, Texas. It will find you a capture area. Here it would be Dallas, I believe, but then you can read exactly what the models tell us will happen with hospital beds. It's a very good link to go to, and I think it would be very illustrative of the challenge that we face. So questions, if you would use the mynethealth.org site, you can send questions there. That phone number is going to be going to a call center. You won't be speaking to me or the epidemiologist or the preparedness folks because we are crushed right now. And I'm going to open it up for questions if there are any.
This time, question.
Hopkins. He is the director at Northeast Texas Public Health District Office in Tyler, Texas, and their phone number is listed on the screen at this time. The second question came by, and I'm going to direct this to the health people. This comes from the mayor of Log Cabin. What is the city's responsibility to control crowds? Log Cabin has a wedding venue and fishing tournaments in the park that are in the park, ? Should we cancel those type events?
So I have no authority to lend to you in making those decisions. I would offer the guidance that CDC has put out, and those are very specific for things like venues where you have congregate activity, churches, wedding venues, festivals, or membership type events where people get together. That guidance says 50 people, no more than 50 people, and can you keep them far enough apart, and can you keep the surfaces sanitized is some of the decision-making issues you need to consider. Also, you have to consider the dominoes behind those decisions. If you close down all the restaurants, what are you going to do for people who, that's how they eat, that they don't go to the grocery store? There's a significant portion of Texans who use restaurants every day. So consequences are many and choices are few right now.
As far as the county's point of view on that, we urge you to follow CDC regulations. Yes, currently it was at 50, and there's been further guidance that even has us down to 10. So I know that it is within more than likely the best interest that you discontinue at this time those type of activities.
I have a question from Kevin Pollock, who is one of the JPs in the county. His question is, what is the R-0 number for COVID-19?
It is between 2 and 3.1.
Okay, I have a question from Elizabeth Borstadt at Athens, Texas. She is the city manager. What are the differences in flu and COVID-19 symptoms?
So flu symptoms, the initial presentation is usually upper respiratory, like sore throat, congestion, headache, sinus, almost feels like a sinus infection. and then you have body aches. The difference, the early signs in coronavirus will be fever and a dry cough that cannot be suppressed.
A question from Tony Clay with Athens ISD. She's also asking for the R0 estimate for COVID-19. And then a secondary question regarding the hospital situation. So you want to answer the,
Yeah,
thank you.
Again,
Repeat
the R0
R0.
number is 2 to 3.1.
Okay. Then the other question is more for probably the hospital district. What is the bed capacity for Athens Hospital? What is their average for bed occupancy? And how many ventilators do we have here?
At this time, we are directing all questions to our partners. They have made a statement this week saying that they have their full force of the entire UT system supporting our hospital and all in the area. Those numbers are going to be fluid because they move from location to location because as I just said, UT Health is a larger system and depending upon the demand, those will be moved. But they have been given us the assurance that this hospital is supported and that it will be available and ready if we have that particular situation arrive.
This question is from Coy Holcomb, Dr. Coy Holcomb, who is the superintendent of schools in Eustis, Texas. He says, in the meeting there was mention of the 5 cases in Smith County. I have heard of a confirmed case in Van Zandt County with a Murchison address. Can this be confirmed?
That is confirmed. We also have 1 case in Gregg County, Longview, and 1 case in Henderson, Texas, which is Rusk County.
Yes. Now, again, this case that is being reported with a Murchison address
It is being reported as a Van Zandt County resident.
I have several questions from Jeff Weinstein, who is a local attorney. 1, do you suggest going to the hospital or calling first to find out what you should do if you believe you have the virus?
So how I would ask you to self-evaluate your symptoms. Are you really sick? Are you just now starting to experience low-grade fever or the cough? Or maybe you know that has just started and you were around one of your clients or business partner or something like that. You hopefully have the opportunity to call. I know that some people are going to hospitals and ambulances, but if you can call the hospital or your provider or that freestanding ER, whatever access points you have to healthcare, if you'll call and let them know that you're coming, that you have suspicion that you may have been exposed and are now sick, that allows them to meet you with proper protective gear. That helps us maintain our force protection. Throughout this event, our nurse and doctors and EMTs are going to be a critical resource that we can't have continually in 14-day quarantines.
Is the number here on the screen a number that they could call?
No.
Or would you direct them?
I direct them to the provider, to the clinician. That's what would happen if you called this number as somebody who is not under the care of a doctor. We will refer you to a doctor. Epidemiologists don't practice medicine and can't evaluate you over the phone.
What about handling money, cash money? Is that pretty contagious or?
Anything that you breathe or potentially aerosolize and ends up on a credit card or money's organic, it holds that virus. So if you're interacting with someone at a cash transaction, before you go and pick up the phone or go back to restock, Dr. Pepper's, then you need to wash your hands. Gloves are an appropriate, as long as you do the latex type.
You mentioned that, you this for Judge McKinney. You're waiting for the first confirmed result before implementing emergency measures. What are some of those emergency measures?
Those measures are consistent with our emergency management plan. Given that this is a different type of disaster, this is one that will not be like the ones we have seen in the past, where you have a physical event, where you see people moving, addressing issues at hand. This is a health emergency event, if and when we call it, and that is opening up the resources from the state and federal government to bring in here. That stands up all of the annexes that we have in our plan that deal with security, logistics, inventory, health measures, legal. There's a whole list that is in every county's emergency management plan that is put into effect. Those are headed by different individuals that have the exact authority over those. And it is a structured system that will help us maintain order and ensure that we have all of the materials that we need to respond.
The second question from Mr. Jeff Weinstein, a local attorney, is he's asking the top 3 things we should do as citizens to help slow down the spread of the virus.
Wash your hands, stay at home when you're sick.
Thank you. And the next question is from Miss Debbie Viergi, who is a school nurse for Murchison ISD. She's asking if there are any cases in Navarro County.
I did not see any a few minutes ago when I checked the Department of State Health Services website. That is, they have coronavirus info on a link. You can pull that up and look for their news updates. They have recently added the ability to put in the number of laboratory tests. I pulled that up a few minutes ago. That number is 1,907 tests in Texas. The Flat Lab, the Public Health Lab of East Texas in Tyler, and those type of folks have done 697 of those tests, and private labs have done 1,210. There are 83 total statewide cases, 2 deaths, and no, the Navarro County has not had a case to date.
Thank you. Okay, 2 questions from the comments on the YouTube video. 1, why are some school districts open and others are choosing to close or staying closed for extended periods?
At this point in time, it is being addressed on case by case and by a local decision making. Once we finish with the questions and answers, we have our state representative Keith Bell with us today, and he can lean into some of those questions at this time. But it is a local based decision is where we stand at now. Each individual school district is, bless their hearts, they really are got a huge responsibility on their hands right now. So when we get from the question and answers, we'll have our representative speak.
The other question from the comment section on the YouTube video is regarding bars and restaurants or local eating places. Is there, how do they make the decision whether to stay open or close?
At this point in time, we are seeing in our community where they are closing the dine-in options, and that is much appreciated. It is at this point in time a voluntary and recommended that we move some of these, but as was spoken to earlier, we have so many people that actually depend upon our restaurant services to find nourishment and feed themselves. That is their lifestyle. So as we move through this, decisions have consequences, but at this time we are encouraging all of the local restaurants and all of the local businesses and our local municipalities to feel along following recommendations. This is not a mandate from the state nor from this county at this time. It is actually another local decision that they are leading up to. to the locals. We're encouraging everyone to be mindful, be that good neighbor, and do what is right for everyone.
Another question from Jeff Weinstein, a local attorney. This question is for Judge McKinney, but applies to, I guess, the group as well. When a case is reported as a Henderson County case, will this kick in a different set of protocols for us in the county?
At this point in time, when we do get a positive case and that becomes official, we will be declaring an emergency. And under that emergency declaration, there are opportunities and authorities given to imply certain standards, as we was talking about. There would be the authority for the restaurants. There would be the authority to do that. In our initial proclamation, it will be a very broad one that will not, I guess it should say, is more very limited in its scope because it is broad, just declaring the emergency. And as the need arises, it can be amended to adjust for what is needed. But at this point in time, we want to take good, solid steps in addressing this issue. Addressing it individually at the individual basis is our most powerful weapon. I believe we've learned that here today in our discussions. At the individual level is where the true power lies in this. And as that's one wonderful thing about the state of Texas is that we are a individually rights power. You know, that's the whole basis of property rights is through the individual. And we are individuals that are given a lot of leeway because of that. And it's upon ourselves to enforce discipline of the hand washing, respecting one another. If you're sick, stay home.
Judge, I have no questions in my queue. Josh?
They're asking about the status of the first responder rodeo, if that's canceled.
The question was about the first responder rodeo. All activities at the Henderson County Fairgrounds have been suspended for 30 days up to April the 18th. Off the top of my head, when is the April 24th and 25th. We are evaluating as we go. We do not have a definite as of yet. But anything up until April the 18th has been canceled.
Question, how many tests do they have for Henderson County?
I'll turn to that.
Tests are not allocated by county. They are assigned to people who are under investigation.
Thank you.
This question says, what if you don't have a PCP but have an insurance or Medicare?
Then my recommendation is that you seek access at the emergency room or a freestanding ER, but please give them notification if you are going to show up.
What was the first part of that question?
Could you repeat the question?
What if you don't have a PCP but have an insurance or Medicare? And the only other one that I have is, how long should we expect this to last?
So this is an opinion. I believe that our initial response is probably going to be 12 to 14 weeks. And if we follow along with what Asia looks like, we'll try to poke our head up at that time. And the experience that they have is that cases tick upwards. And so they have to enact local controls in that immediate area, do the contact tracing. And so they are trying to lift some of the controls and at the same time really heavily monitor the spread, because it does continue as they try to dig themselves out.
Any other questions?
I have, there's one in the audience.
Yes.
So how long does it take to get a result back?
So the runtime in a machine is 4 to 6 hours, but you have limited space within those machines. Our public health lab capacity each day is 50 tests. Now, that's not very many, but the private labs have come online, and we are pushing a lot of the clinicians to use that. And they are. And now it's taking about the same time it was taking CDC to do it, which is anywhere from 3 to 5 days to get a result back.
Yes, ma'am.
I have a question. If you mentioned that our hospital doesn't have any tests, so if we don't have any tests and you're a PUI, you call them and you say, I think I may have it.
You won't be a PUI until you're issued that number, which would be after the hospital visit.
Okay,
So I know what that is.
So you go to the hospital, I'm not through. You go to the hospital and you say, I think I have this. But you said, we don't have any tests.
Right.
So here at this hospital. So
Right.
then what?
So they pull the specimen.
How? Because you said we don't have any.
You're not doing the test here. You're doing the test in Tyler in a private lab. You take a swab like you would for strep or for flu. You get an oral nasopharyngeal swab. You put it in the medium, break off the end of the swab. You package it. You send it to the lab.
And so how much time does that take? All that?
Depends on where you're at.
Well, let's just say we're right here in Athens.
Well, it's an hour over to the lab.
Who takes it to the lab in Tyler?
I don't know who the,
I believe he answered the question earlier in the fact that once they have taken the sample, it then takes 3 to 5 days to process
Yeah.
that as the laboratory before a result is given back.
So they wouldn't just take one person's, obviously, they wouldn't just take one person's tests.
yes, they would. So if there was one person up at Cedar Creek and we issued a monitoring number, a sample specimen would be obtained and it would be sent to the FLET lab if that's how we're going to test it. But it would be, we would transport that individually because FLET lab serves 35 counties. So we can batch them, run them together, and the reagent that they use in this process you can extend the life a lot longer if you're running batches. We currently have about 1,600 tests at the laboratory that they can perform, but if they ran them individually, it would be about 800. So we will send it immediately so it can get in the queue,
Gotcha.
but we'll wait until we have a full machine to actually process.
Thank you, Mr. Russell. With us today, we do have our representative, Mr. Keith Bell. He is here and would like to, just kind of an update. There are a few items that are very important, especially when it comes to the school. So, Mr. Representative.
All right, thank you. Raise the speaker. I heard that they can't hear you real well. There you go.
Well, I hate to have to be here with you guys today in such these circumstances. These are perilous times. I told my own people last week and today, I've been a CEO on my own company 37 years. I ran a company through multiple recessions. The dot-com bubble, 9/11, Y2K, H1N1, the SARS, swine flu, Zika. Bottom line is, it's how we react to this. It's 10% what happens to us, 90% how we react. And then you can only control the controllables. And so let me give you some updates. I know there were some questions concerning the schools. I'm going to give you some updates of what the governor's done at this point. You've been shared the statistics. There's been 3 deaths. It was while I was standing in the hallway. We have a death in Collin County. So besides Tarrant, now in the Dallas area, Collin County. The governor said in his press conference by the end of the week, With private labs, we should be able to do 15 to 20,000 tests a day. You need to understand that if you go even in a drive-through lab, they've got those in Dallas. You have to go on Baylor Scott and White's website. You got to fill out a questionnaire. A doctor or a nurse will ask you some more questions. And then until you have a doctor's orders, you can't get a test. And you're going to have to meet all that criteria before they're going to do that. So that just gives you some idea. Testing protocols have not changed, will not change at this time from what we understand, even as the testing and the ability to test increases. From a school district, that question was asked earlier, why are some open, some closed? School districts are local control. The superintendent has absolute authority to keep a school open or close it. In an incorporated area, the mayor next can declare a disaster declaration, and based on the quantity that he puts on it, we'll close a school. So a mayor can order a school to close. In an unincorporated area, that lays at the hands and the feet of the judge and the commissioner's court. The judge can issue a declaration, a disaster declaration for a public health concern, and it's good for 7 days until your commissioner's court extends that, and that's the only people that can do that. If the commissioner's court and the judge does that, the judge supersedes what's going on. You saw that happen in Dallas. You've seen it happen in Collin County, Tarrant County. The judge can say that no more than 50. I was on a conference call yesterday in Kaufman County. Part of the conversation was to reduce in restaurants, and that is a concern, Judge, about making sure people have a place to get nourishment, reducing that to 50% of whatever the fire department has said is your certificate of occupancy, just to do the social distancing. This is a real issue, and everything the state of Texas is doing is to stop the disease spread, slow it down, and flatten the curve, as you've heard from somebody that's a professional. I'm an electrical contractor, and so I can't expand upon that, but that is what we're doing. And so to understand where we're at with the schools, the state, as of last week, I've been on a daily, matter of fact, at 3 o'clock, I got to be on a conference call with the TA Commissioner, Mike Morath. I'm on the Public Ed Committee. There's 9 of us in the House. We've waived any consequences concerning school finance. So if a school district decides to close, they're going to continue to be funded based on their populations. There'll be a drop down on where they do their attendance, COVID-19. If a parent wants to keep a child at home, then that's their choice. Even now, if a school's open, and the school district will still be funded. If a school closes, you'll still be getting 100% funding based on your population. So bus drivers, cafeteria workers, and custodians will continue to be paid. Hourly employees will still continue to get their pay. Any attendance requirements, as you well know, the school districts have a state attendance requirement. That has been waived. And so from a school TEA perspective in schools, their number one concern is public health. If a school district stays open or they close, the TEA, the commissioner, Mike Morath, is going to support that superintendent's decision. There are some districts where there is no confirmed cases. There is no community spread. You can look at the maps, and they're all over the internet. There's a lot of places in West Texas that this doesn't exist. There's not a single confirmed case in Lubbock. And that's the largest community, town, city, municipality in West Texas. If there's no use to close, then school districts aren't closing. If they feel like, the superintendent feels like it's in the best interest for where there's community spread, where there's somebody that's positive, then that's what we do. What we've seen is we've seen about half the school districts in Texas were closed last week for spring break. The other half are closed this week. Most districts closed last week, closed for the second week. Those that are closed now will probably extend into the second week. The commissioner has asked everybody as school districts to prepare if you needed to close. Prepare in the event this is extended significantly. UIL has already canceled all UIL activities for the rest of the year. And so the first thing is public health. Number two is food service. In the school districts, some of them in my district, 60% of kids are low socioeconomic. So what are you going to do with your food service to continue to feed these children, whether they're in school or not? That's the next concern. Third is institutional support. The TEA says we'll continue to fund your district as long as you provide some kind of instructional support. And we've got all kind of latitude that we've gotten from the federal Department of Education, but not in special ed. So special ed services, and for some of those that are very profound, some of our most fragile students, those services are going to have to be provided. And so these districts are closing for the second week to try to figure out what's the operational challenges and changes we're going to have to make if we're not having school. And so as you see the social distancing, as you see the policies occur, as you see the predictions, it is highly probable that this will be extended. Once they close, that those closures would be for longer than just the foreseeable future. Testing and accountability, the STARS test was waived by the governor on Monday. SSI, which that's where you test a child to go from 3rd grade to 4th grade, 9th to 10th, those are waived now. Any test for end-of-course exams for a child to be able to graduate, those have been waived. Laying the foundation that if this is protracted, the governor's already put this in place. That catches you up on the school stuff. Once again, it's local control up to the individual superintendent and that school board until they are trumped by a mayor or a sitting county judge. As far as other things the state has done at this point in time, the governor has fast-tracked temporary licensing for out-of-state physicians, physicians' assistants, retired physicians, nurses to assist in-person and telemedicine services, distributing an allotment of supplies from the Strategic National Stockpile, which includes surgical masks, respirators, face shields, etc. throughout the state. I was involved in that process just this week in this district. Waiving certain trucking regulations to streamline the flow of goods and supplies to grocery and retail stores throughout Texas, waiving laws that prohibit trucks from the alcohol industry from delivering supplies to grocery stores, waiving regulations to ensure students enrolled in the work-study programs will continue to receive credit, and as I said, waive the STAR testing requirements for the 19-20 school year. In addition to that, then this occurred yesterday, or day before, Governor Abbott waived certain vehicle registration, titling, and parking placards for handicap parking. That was waived. Your driver's license was extended. If you had a driver's license or an ID card of which you would have had expired March the 13th, you now have up to 60 days after the state declaration ends to get those driver's license and so forth renewed. The last thing that I know that occurred just today, because I just got the email, and this is very fluid, and I think everybody can appreciate that. I just received an email today that says, Governor Abbott has issued a proclamation allowing political subdivisions to postpone their 2020 local elections. Local governments now have the ability to postpone their May the 2nd, 2020 elections until November the 3rd. And so that's the latest, and that just happened here a few minutes ago. So once again, this is very fluid. I wanted to come down here. I told the judge, McKinney, that I would come and try to give you an update of what we're doing as the state of Texas. You know, the testing is ramping up. I was listening to the governor speak in Arlington. We had a death in Arlington yesterday. So the governor will have another statewide press conference tomorrow. They have asked judges and electeds to provide information of what you're doing, where you're going, how you're compressing in your locales, and where you're headed with your local disaster declarations. I think you may see a little broader what occurs, and it's no different than the county. The county, and for instance, Kaufman County today declared a emergency declaration for public health, and that's all. And what that does is it instantly allows your emergency management systems, your local municipalities, school districts to start collecting their cost as it's applicable to COVID-19, and then therefore that can go to the state emergency management and then go get that money from the federal government in the future. So it also creates some powers that the county doesn't have, or the judge doesn't have, when he pulls that trigger. No different than a mayor. When a mayor does that, then they have powers and duties per the Texas Government Code, of which they can have a lot of latitude. One of the other things that the Attorney General Paxton did is if you need to have an emergency meeting, you're not required to have the notice. You can have the video conferencing that we did today, as long as there's an opportunity for people to ask questions. It is recorded, and that recorded can be distributed in the future. And so, once again, that's a quick 10,000 feet overview of what we're doing. And the governor, I commend him. Him and his staff are working around the clock. Typically, I'm on at least 4 to 5 one-hour conference calls a day, and have been since Thursday last week. I'm either on a governor's conference call, TEA conference call, a conference call with Kaufman County, or I'm communicating with Henderson County. It's my job. Man, I'm telling you, I'm making about $1 an hour right now for this $600 a month salary. But here's what I'll finish you with before I answer some questions. These are challenging times, and we just need to control the controllables. And most of us, and I don't think I'm stepping out too far, are people of faith. So we need to act like people of faith. We do not have a spirit of fear or timidity. And in the optics of how we react, our perception is going to be our reality, and the perception of the people is their reality of whether or not those of us in elected position and leaders are acting like such. There's opportunities to lead, there's opportunities to make a difference, there's opportunity to volunteer. Man, there's just an opportunity to pray and support. Because if you get this virus without a cure, then you need to pray. And then you get oxygen. And then maybe you're intubated. And it's only God's will of what the outcome is. And that's no different than me driving down here. It's 1 hour and 10 minutes from my office. And it's 1 hour and 10 minutes back. And so, man, let's lead. It's opportunity. And last, it's optimism. We've always won as Americans. As Christians, we've already won. Right? So let's lead and let's move forward as leaders. You've all been elected, a lot of you, in these positions. I commend the judge. I've been in touch with him since this almost began. Whatever service I could provide. The mayor sitting back here called me at 3:02. We had his issue saw about a little after 4 o'clock on Monday. That's my job. My job is I've got a full-time person sitting in an office in Austin. I got a full-time person that lives right around this corner over here, got an office on the square. That's our job. If we need help, the SBA has already stepped out for small business loans. We don't know how this is going to affect. And what I will tell you as a CEO and a businessman, the long-term economic effects may be even greater than the outcome of the virus. And we need to be prepared for that as for the people, because it's those that create jobs that are keeping this economy rolling. So thank y'all for your time. With that, I'll take whatever questions I got, and then I've got to get on that call.
Thank you, Mr. Bell. for
Yes.
being here. I have one question that might be more your lane to answer.
Yes.
It's from Cane Springs Fire, Alan Eric Killian. We're critically short on PPE, which is personal protective
Right.
equipment. How and when can we expect more?
Okay, just as we have had that other places within my district, reach out to the county judge. He'll send you, or reach out directly to the Henderson County Emergency Management Coordinator, and that they will send you to where those resources are, so we can get that resolved. So I trust that got resolved with the previous. So if they'll reach out, any first responder that's listening, that was part of the process the governor did up front. So reach through your local office, county office, emergency management. If in fact that's a problem and they don't have those resources, I'll do just as I did earlier this week. I'll reach out to my chief of staff, who will call the Texas Emergency Management Coordinator, and we run that backwards from Austin all the way back to your local. You've got your first responders have to have those products. Anything?
For those watching, just for your information, I am the Emergency Management Coordinator for the county. I have sent out the emails reaching out to all of the first responders in the county, requesting an inventory and giving them guidance as to how to do that. So thank you for the response. We appreciate it so much.
If there's anything else that I can do, the judge, the mayor, the commissioners that are here have my cell phone number. This is 24/7 for all of us. And so, all I'd ask you to do is remember our first responders. They're going to be the first people on the scene as this thing ramps up. And I don't think the estimates are unrealistic. So be with your first responders. Support them, pray for them, their families. Pray for our national, state, and local leadership. With local control, the power and the decision-making lays right in this room today. And they're going to have to make some really hard choices for people. And we all got lots of experts on Facebook. Okay, I can medical, a matter of fact, he mentioned it, but I can assure you, everybody's got an opinion, but at the end of the day, leaders got to lead, leaders got to make hard decisions. Make them, stand by them, own them, and be unapologetic, because I can tell you, will we make mistakes? Absolutely. But we won't do it without prayerfully considering and surrounding ourselves with people way smarter than we are at the end of the day to get all the input we can. So my office stands ready. I am. If I can help you any way, I'll be glad to do so. Thank you, Judge, for inviting me here today. And God bless you, and God bless the state of Texas.
Yeah, there we go. There we go. Representative Bell, thank you very much. And again, the state of Texas has, Representative Bell and the state of Texas have all been ready to help us at the drop of a hat. We're going to stay within, like I said, leading your church. This will pass, but we all have to do our part. Thank y'all very much for being here today, and thank you.